Hello, this is Dr. Katie from Craig Chiropractic and Kinesiology, and we're going to continue our discussion on multiple chemical sensitivities. If you are new to this topic, I encourage you to go back and listen to the previous video where we share a little bit about what multiple chemical sensitivities are and what that can look like. So just as a brief review, multiple chemical sensitivities is a type of medical condition where the patient in question has reactions to chemicals. Now, chemicals can vary, of course, that cause the reaction, but the thing they have in common is they almost all have some kind of scent. Now, this can range from the most obvious, like a very strong perfume or hairspray, all the way down to pure grade essential oils, and even things like plastics or hot metal, anything that can have a type of scent. That is, generally artificial, but even some natural scents can be too much, depending on how severe the sensitivities are. So in the last video, we discussed that this is a real physical medical condition, but there is psychological components, as this is very stressful for most people. If you were to interview somebody with multiple chemical sensitivities, most of them would testify that this condition is very stressful for them. It makes it hard for them to function in life, to hold down jobs. If you can imagine that you react every time you're near an artificial perfume, for example, and you go to an office building, there are perfumes everywhere, from like the sprays in the bathroom to what your coworkers are wearing for perfume or cologne, to the laundry detergent people wear, the Scentsies they put in the rooms. You just name it, and our world is very scented, okay? Candles, diffusers, things like that. Car refresh, like scents, things like that. So it can make it very hard, especially if the person's reactions include things like headaches, brain fog, trouble speaking, slurring, disorientation. That's very, very hard, okay? So it's important to show sensitivity for those that have this condition, of course, but it's not the most understood. I think we're starting to have more research on it now, but just some things to keep in mind. What are things we can do to treat it? Now, from a alternative medical perspective, kind of more the natural world, which is what I work in, we consider things like detoxing is huge. A big factor for people with these types of sensitivities is that their body struggles to break down the perfumes or the scents. So often supporting liver detoxification. Now, it doesn't have to be an aggressive detoxification, but even gentle things that are great supports. Things like milk thistle are wonderful, dandelion root, things that naturally help detoxify the liver. Another wonderful supplement is one called TUDCA. This has come out more recently. I would say the past 10 years or so, more doctors are using this one. This is an excellent liver detoxifier. Another excellent supplement to help those with chemical sensitivities is something called molybdenum, okay? And there are a few companies that make some excellent supplements that contain these type of ingredients already to be helpful. Now, everybody's going to be a little bit different on their needs. With any patient, I recommend things like working on gut health, helping liver detoxification. If you do have chemical sensitivities, doing the best you can to avoid the triggers, of course, or avoiding the scents are going to go a long way. But again, that's not a long-term solution. That's just temporary. These supplements can help. Anything to help balance the nervous system. So things like chiropractic care, acupuncture, seeing a naturopath, helping support those liver detoxification pathways. Something else I would like to note, many patients with multiple chemical sensitivities. Now, I will say I see it traditionally in female patients. It's not that a male patient can't experience these things, but most commonly we see these symptoms in female patients for the higher severity levels. Okay, typically these female patients, what they have in common is they also deal with things like trouble with liver detoxification. They almost always have some type of hormonal imbalance, often caused by the lack of liver detoxification. Many of them also struggle with chronic constipation. You'd be like, what does this have to do with anything? Being able to have a healthy bowel movement every day is important to detox, to get toxins out of your body. And if you can't, things backlog and we have problems. So being able to go daily is huge. So you want to address things like constipation. Make sure we're staying hydrated. This might involve things like working on gut health, working on hormones, but really targeting that liver. Another fun fact, those with chemical sensitivities often have sugar sensitivities. So you have a hard time breaking down things like sugar. So it's important to, cut back on your sugar intake and really support those digestive enzymes and help liver detoxification. So those are some of the biggest things I can recommend at this time. All right, thank you for listening, and we're going to pick up with chemical sensitivities more next time.